Afternoon. This is Carmel Angelo, Mendocino County Chief Executive Officer, and this is our Friday afternoon media update with Dr. Noemi Doohan. And also today, our guest with us today is Sheriff Matt Kendall. So Dr. Doohan will be doing an update on what's happening with our COVID-19 activities and, of course, our case count within the county. So at this time, I would like to turn it over to Dr. Doohan.
Thank you, CEO Carmel Angelo. So Mendocino County, this has been a very big week for us in the pandemic response. We did hit 30 cases yesterday. So this is a large number of cases for our county as we've been escalating over the last months. And we have had a total of 4 hospitalizations in the last week. We have had at least one of those hospitalized individuals return home. And so we currently, as my last update was, we have 3 people still in the hospital, but nobody requiring a ventilator, nobody critically ill, and that's great news. So the hospital has been able to provide the needed support to keep these people healthy and recovering. So I know that all of us are very concerned about having 30 cases. Of these cases, I did have posted on our tracker this morning that we have 3, which we believe are due to community spread. But I will share that one of them is being questioned whether it was a true positive or a false positive, and I'll get into that more. So let me just say that we have 29 cases, and that one of them is being questioned whether it is an actual true positive. That question will be taken to the California Department of Public Health. COVID-19 is a mandatory reported disease to the state, and the state would be the one where it would be determined whether it could be this 30th, or it's not the 30th case, but one of the most recent cases would be reversed in terms of its designation. So putting that one question case aside, there are 2 cases within our recent ones that I am calling community spread. So what is community spread? Community spread is when we do our case investigation and contact tracing, and we can't find any connection to a known case or and to an outbreak that we're investigating, and that case did not come from another county. So we have had cases that had contact with another county, and we don't know how that person in the other county got COVID, but our own case we knew had contact with someone from another county. I hope that's not too confusing. But in the 2 cases that we have had recently, they have had no contact with anyone outside of the county. They have had no contact with anyone that they know of that has had COVID. They are not related to an outbreak. Nothing about these individuals point us to any contact. And so that's when we call it community spread. Community spread is when we really don't know how that person got COVID. So the 2 recent cases that are related to community spread, one is from the area that we're calling North County, because we divide our county into regions. And one of them is from the region we call Ukiah Valley. So of the community spread cases, one is from North County and one is Ukiah Valley. The 3rd case that's in question, I won't comment on that now, but we're going to remove that as soon as we're out of our press conferences from the community spread. So regarding the cases that we have, in the beginning of this pandemic, the cases came with quite a lot of separation in between them. Our first 6 cases, the first one seemed to be related to contact in Palm Springs. The next one was a cruise ship. One was from the southern parts of the United States. Another was from New York. Another was an early release from Chino. All of these people returned to our county and went straight into isolation for the most part, and we followed them closely with our excellent communicable diseases team. And what we do now has become quite routine: contact tracing, the isolation and quarantine orders, and so on. Then our next cases came from the Round Valley outbreak. And everything that was done by our partnerships with Round Valley was done with excellence. The tribal leadership, the clinic there, the community itself, there's every indication that that outbreak at Round Valley was contained. And we have not had any other cases come out of the 2 households that went into isolation and recovered fully. So I consider that outbreak on that reservation to be resolved and contained because of the excellent work and the partnership with Round Valley. Then we had an outbreak at the church, which the church did self-identify that this was the Assembly of God Church in Redwood Valley. And that outbreak involving the people that were in our county, the 7 people in our county and the 2 people from Lake County has also, as far as we can tell, resolved. So we've done surveillance testing, we've put the word out, and we've repeatedly done testing with that community and no new cases. And in fact, the people that have been hospitalized, one of them has actually gone home and recovered. So good news from that outbreak, and it does seem to be contained. There was then a worker from Sonoma County who lives in our county, and that individual, we collaborated with Sonoma County, and the place where they worked did surveillance testing, and we did not find any new cases in that workplace other than the one in Sonoma County and the one in our county. But that individual did have close contacts in their own household, and there have been some cases related to that individual who's a worker from Sonoma County in our county, close contacts in their household have tested positive. And this is something that we see. We know that COVID spreads in households and that people in the same household will come up positive. And that's why we quarantine everyone in the household and we have the sick person isolate. And it's actually very effective to contain the spread when we do this with households. And that's what we've actually been doing all this time with our communicable diseases nurses. We support people to stay in isolation and quarantine in their homes. Then came a new case, which is an individual that lives in the Ukiah Valley area, but has a close contact in this area that is North County. And that is leading us to be concerned about more cases in North County. So there are some additional cases that have come up this week that are related to a connection between Ukiah Valley and North County that we're still investigating. And that is a concern because in the North County area, we want to really message that the public health's role is to be supportive, to provide free and anonymous testing, to support with isolation and quarantine housing. And that's the messaging we're sending up to North County when we do have a presence, for example, in Covelo. We want our presence in public health to be seen as we're continuing to do surveillance, we're continuing to offer free and anonymous testing. So that's what I want to say about the cases to this point. We do continue to protect privacy. We do continue to not identify the actual town or workplace where people live because we work very closely with those workplaces, and we are confident that the case investigation and contact tracing we're doing in partnership with our communities is going well. I have heard lately that there's an idea that we're having more cases because we're doing more testing, and I don't believe that's true. We have done over 3,000 tests, nearly 4,000 tests, and we've had 30 positives. That's about a 0.8% positivity rate. It's actually a low rate, less than 1%. And the new cases that have come up have not been from our surveillance testing. There was one case you may have all heard about that came out of surveillance testing in Anderson Valley, but that individual actually lives in another county and returned to their own county. Associated with that case, we're doing more surveillance testing in Anderson Valley. But regarding the surveillance testing, other than that one case, we haven't seen cases coming out of that. Where we're seeing cases coming out now are people going for clinical care because they're sick and they're coming up with a positive test. So these tests are coming from our hospital clinic partners. And this is telling me that we really need to encourage our population to come for surveillance testing, to please come for OptumServe, to please come to the surveillance testing that's being done by our city partners, and to please come in Covelo for testing, because we are not getting positives from our surveillance testing. We're getting them when people are coming in sick, which you could consider to be they're coming in later in their infection. And if we could catch them earlier, we could contain whatever outbreaks might be associated with these individuals. So I do believe we've reached the point now where we have community spread in our county, which means that we don't know who has the infection. And this is where the mitigation factors that I've talked to you about for months now come into play. The facial coverings, which we should be wearing in public, which workers who prepare food should be wearing when they prepare that food for sale or for being served to other people outside their households. In medical environments, we have medical masks being worn, and that's another order that I have. Also, we have limitations on gatherings. All of these are mitigation efforts to help slow the spread and flatten the curve. We can see the great benefits that we've had from slowing the spread and flattening the curve in our county, because there's now an FDA-approved drug called remdesivir that is in crisis level shortages because it's a new drug and it's being distributed by the federal government to the states and then the states to the counties. And this drug is not in widespread, it's not readily available because it's in shortage. It's in crisis level shortage. But we do know that those people who do receive this drug when they're hospitalized, if they can receive it early in their disease, can have a significant improvement in terms of the severity of the disease and the length of time that they're ill. And so we are very hopeful that as time goes on, we'll get more of this drug and that other drugs will be developed that can help with our treatment of COVID-19. Also with time, our hope is that we will get a vaccine. So the more time we get, the more prepared we will be. And in the county, we've been working tirelessly with our team to do all of the things, every single thing needed that we can do to prepare, such as training up our staff and volunteers for case investigation and contact tracing, doing testing, and we have been doing testing at 1.5 per thousand, which is about 135 tests a day for our 90,000 population. We're doing that through OptumServe and through our clinical partners and through our county work with public health in Sonoma County and in the state lab and through the UCSF free testing program. We've also been very effective with containment in the isolation and quarantine housing that we provide for individuals that have COVID and they are not able to have isolation safely where they live, or they might need quarantine for family members. All of these things we've been doing, and we will continue to do them. But the time that we've had to prepare has been life-saving, and we will continue to work hard to develop our containment and mitigation strategies. This is a time which I had predicted would be when the pandemic would start to hit us hard. I predicted that it would be the end of May, and it is happening to us in the end of May. And it is going to get worse before it gets better because we are opening up. We've had the limited reopening that I promised would happen as soon as the governor allowed, and that opening has been significant. At this time, in Mendocino County, we are as open as any other county in the state. And additionally, we're even more open in some areas where I have worked with county council with my orders to move into what I call the gray areas that the governor allows. Areas that have allowed me, for example, to write orders that allow social bubbles, like the household support units, which I believe are in alignment with our governor and are in alignment with what is expected of us as a county, but is also giving us some more freedoms. This week, there was very big news that the governor announced that we could open up places of worship. And this was done, although this is going to be a high-risk activity regarding COVID, it's also going to be a highly beneficial for our community so that we have hope and that people can express their faith together with their congregations. But I'm very concerned as your health officer about the gatherings that are going to happen and that there may be further outbreaks. So as we do come together for these gatherings, I do ask every single person to please be very, very careful and wear facial coverings and social distance, stay home when you're sick, don't shake hands, wash your hands frequently. All of these things that we've been talking about as you come together are very, very important for preventing further outbreaks. But regarding the new orders, which were released yesterday, and I promised the faith leaders I would release them yesterday. We only learned about them on Monday, so I promised I would work hard with County Council and get them out so that services could resume by tonight. And the guidance in this order, or the orders themselves, say that there's an exception being made to the ban on gatherings for places of worship. And this can be up to 100 people or 25% of the capacity of the place of worship, whichever is less. So if it's a church, let's say, that normally has the fire marshal says 100 people could be in that church, then they could have 25 people in the church with social distancing, or go outside and have an outdoor service of up to 100 people. So it's up to 100 maximum, or 25% of the facility, depending on what is less. That's all outlined in the orders that have been released yesterday, and it will allow for places of worship to have gatherings, and that can start today. Also, in the governor's order, which I then followed with my own, is that we can have gatherings for protest. And that is the same idea, up to 100 people with social distancing. The reason why the governor, even though these are high-risk gatherings, any gathering at this time is high risk, allowed places of worship and protests to be open for gatherings is because of the constitutional rights. Additionally, the state did allow us to open at the county level hair salons and businesses that are there for providing services for hair. That's hair on the head, not hair on the face. That was very clear from the governor because we're worried about close face-to-face contact and the spreading of COVID. So all of that is in my new orders. The facial, all of that, the worship gathering, the protest gathering, and the hair is all in the sheltering in place revisions that came out yesterday. There's one other element of that is opening up therapeutic swimming pools for the purposes of physical therapy. The governor has not allowed the opening of public pools, but for this is an area where for medical or purposes where someone's been referred for physical therapy, I have put in my order that the pools could be opened up. So I have been asked to address actually 3 points, which I want to share with you. Thank you to our PIO team who has closely watches social media and brings questions to me that rise up out of social media. And so I want you to know, to our public, communication is a top priority for us. And we hear your questions and they come to me in a variety of ways. One of the ways is through our call center, and then I address those in FAQs with County Council to the orders. Others are through social media. So here are 3 questions that I received. One was, and there were a lot of people who had the same question. One was, what is the region of each of the cases of community spread? So I answered that already. One of them is in question, so we are going to allow time to let the California Department of Public Health give us an answer of whether that was a false positive or not. The other is identified as North County and the other in Ukiah Valley. These are some of the recent results we got in just the last couple of days. The other question is an excellent question. What is the protocol for declaring someone recovered? So this is in my blanket isolation and quarantine orders, which you can see on our Mendocino County website. The blanket isolation and quarantine orders are there for anybody who is testing positive or their close contacts. They are ordered by the health officer to be in isolation or quarantine. So it's you could call it a standing order. Those orders are handed to individuals by those clinicians who performed the test, if that test was performed in a clinic or hospital. And so the clinician becomes, if you want to say, like an intermediary in those orders, but they are the health officer's orders. So in those orders, if you take a look at them, a person who tests positive it must remain in isolation for 10 days from when they had their positive test, or if they have very clear onset of symptoms, from 10 days from the onset of their symptoms. So let's just keep it simple and say 10 days from when they were tested. They need to be in isolation. The reason why we use 10 days is that's the CDC guidance for when somebody is no longer infectious. There's another piece of that. It's not just 10 days from their test. They have to be without a fever for 72 hours without any medicine to lower the fever, and they have to be improving. So in order to be recovered, there's three things: 10 days from their test, and and no fever for 3 days without any medicine like Tylenol, and recovering. So that's what we use in the county when we are monitoring people and we tell them they're on isolation at home. For quarantine, it's 14 days from their last contact with the known case that they need to stay in quarantine. Quarantine is for people who are not sick, and isolation is for people who've tested positive or are sick and we're waiting for their results. The other question that I was asked through social media is about the COVID test accuracy. The accuracy relates to the proportion of true results. Do we trust a positive if it's a positive test? Do we trust a negative if it's a negative test? And for PCR testing, which is the swab testing that we do in the nose, the nasopharyngeal swab or any of the nasal swabs, and those tests are done by PCR, those tests have lower sensitivity and higher specificity. That's language that we use in public health to define how good a test is. The sensitivity that's lower relates to a false negative reporting. The specificity that's higher relates to false positives. So let me summarize it by saying that the PCR tests rarely have a false positive, 1 in 100, and more commonly have false negatives, maybe as much as 20% of the time. The false negatives are the things we worry about with the PCR testing for COVID, false negatives. We focus on, we're not sure we trust the negative, especially if somebody is without symptoms and early in their disease. So that's why we want to be sure that if someone has symptoms and they test negative, we would test them again. And also when we talk about the Abbott ID Now machine, that one has even lower sensitivity, meaning it has an even higher false negative rate. So in general, if someone's positive, we trust that positive result. We say it's a true positive. It's the negatives we question. And that's why we might tell someone that they had a negative test, but if they're really we're concerned, we'll test them again to see whether they remain negative. And in general, if someone has 2 negative tests in a row and they've never had a positive before that, then we can trust the negative. So again, we trust the positives, we question the negatives. But as I said, we have 1 positive test that we're going to take to the state. Because of the circumstances around it, we're going to question whether maybe that one was a false positive. So in summary, I want to thank Mendocino County. I want to thank all of our team at the county, all of our team in the community. I want to thank our sheriff. Our strength is our unity. And as we go into this next phase, which I believe is going to be more difficult, we have community spread, we're opening up. I just hope and pray that we can be united and we can keep each other safe, we can be good neighbors, and we can follow the health officer orders. So with that, I do want to hand it over to our sheriff, Sheriff Kendall, to see if you have words you'd like to share with us today.
Thank you, Dr. Doohan. Can you hear me?
Yes.
All right. So I just wanted to share just a few things. Dr. Doohan brought us some really good news today with the new abilities for treatment. The 0.8% infection rate, that's good news, but we have to remember we're at 0.8% because of the work that we've all put into it. We as a county have come together and put a lot of work into things, and these numbers are down. So our original goal of flattening the curve, so that we could buy ourselves some time to get somewhere on this, we've gotten there. We've done a good job. The next phase is going to be hard. I think we can all agree that everything that Dr. Doohan has brought to us has been based on science, and it has been extremely accurate. And when she says the next phase is going to be hard, we need to be ready for it. Right now, people are afraid and concerned for their families and themselves. Let's all be kind to each other and not cause them more concerns. The Sheriff's Office is continuing to put more resources into the county for patrols and whatnot. I feel very fortunate right now that with the courts being where they are, I have some extra personnel that would normally be working the court system. And so we've been able to move those deputies into the areas where we're having little issues here and there. And we're going to continue to move on this. And most of these resources have gone to the coast over the weekend. We've done a lot of extra patrols and taken care of some things over there. The new cases, yeah, they're concerning, but we're going to continue to work together and deal with the contact. Right now, crime is alive and well in Mendocino County. We've seen a big rise in violence. I'm really concerned about child abuse cases because the number of reports are down, and it's not because children aren't being abused. And so we've been working with the schools, trying to find some new and exciting ways through social media platforms and things like that to keep our teachers and some of our spiritual leaders connected to the kids out here. Because if we don't, then we're going to have a lot of things that continue on and they need to be stopped. As we move forward, I just want to remind everyone in the county, we're all in this together and we need to work together to keep each other safe. Look out for your neighbors by using the good social distancing and the facial coverings. If you see a situation that concerns you, remove yourself from it in the same fashion that I would ask you to keep yourself safe from crime. Be aware of your surroundings, protect yourself and your family in the same fashion you would, protecting yourself from crime. If you see a business that you don't feel comfortable shopping in, then don't give them your business. There's some of this is, I know people are going to say, wow, that's common sense stuff, but sometimes we need to remind ourselves of it. I've gone to businesses where I look in the door and nobody's wearing a facial covering. And then all of a sudden I think to myself, well, I'm wearing one. This was before the last order. And I turned around and went to a different business. But I had to remind myself of it because it's not every day for us here in Mendocino County. We're getting a lot more accustomed to it. And I think by the time that we get done, a lot of our social interactions will change. And this is going to cause a change. And perhaps one day we will get back to where we used to be. But let's just look out for each other right now and be thankful for the work that's being done. That's about all I've got to say.
Okay. Well, thank you, Sheriff Kendall, and thank you, Dr. Doohan. So before we end our day, I would like to just remind the public about a few things, a few services, and a few phone numbers. First of all, Mendocino County continues to have a call center open, and the purpose of the call center is to answer questions from the public regarding COVID-19 and county services as well. You could also report code enforcement issues on the call center line, and that number is 707-234-6052. That's the call center. We also have a warm line, and this was started under Dr. Janine Miller in Behavioral Health and Health and Human Services. The warm line is a non-crisis support line that you can call if you need someone to talk with or some services as well. And that number is 707-472-2311. And lastly, I would like to talk about our testing site, which is OptumServe. This is a collaborative effort of the federal government, the state government, and local government. And we have the good fortune of having an OptumServe site here in Mendocino County, and we could test 134 people a day at that site. Now, some of you know that Mendocino County Public Health staff does send teams out into the community, into some of our outlying areas to do testing. However, our stationary site is at the Redwood Fairgrounds here in Ukiah on State Street, and that is at Carl Purdy Hall. And they are open Tuesday through Saturday, 7 a.m. to 7 p.m. And again, this is for COVID-19 testing. testing. And how you schedule an appointment is by going online to lhi.care. That's the website. You could go online and schedule an appointment for a test. Additionally, there is an 800 number. That 800 number is 1-888-634-1123. And so either the phone number or the website you can go to and you can schedule a test. What I would also like to say is what we've said from the beginning of OptumServe. This is free testing for COVID-19. When you go online to schedule your appointment, you are asked a series of questions, just like you are if you're scheduling a clinic visit or a doctor's appointment. You are asked if you have insurance. Please do not let that stop you from scheduling an appointment. Again, the COVID-19 testing is absolutely free at the fairgrounds. So again, you have a question, you answer it, you don't answer it. This is all free testing and it is non-discriminatory. COVID-19 is non-discriminatory. The services we provide, this testing is non-discriminatory. So please go ahead and call and register for a test. Again, it's Tuesday through Saturday, 7 a.m. to 7 p.m. So with that, again, I'd like to thank Dr. Doohan. I'd like to thank Sheriff Kendall. And I'm going to turn this over to Sarah Duquette. Thank you.
So first up for media questions today, we have Mike Adair with Willits Weekly. Mike, you're on. Let me
You're muted.
Mike, you're muted.
Okay.
There we go. We can hear you. Yes.
All right. So my question is, we've had quite a few cases here recently. Dr. Doohan, do you feel like it would be appropriate to move us back, sort of backwards to the beginning of phase 2? What do you think?
No, I don't. I think that I don't want us to go backwards, and I don't think we need to. I think that what we need to do, however, thank you for this question. I do ask Mendocino County that we have patience and we hold where we are for 2 weeks. I think we need to not have further opening beyond where we are now. And we need to see what the impact is of the opening that we've had, but I do not want to see us go backwards, and I do not think that we will. We are working so hard on our case investigation and contact tracing and providing isolation and quarantine housing. We have such great collaborations with our partners, the clinics, the different agencies. I think we're going to be okay, but it's not going to be easy, but I don't want us to go backwards. So I'm going to say I do not believe that's going to happen, but we do need to hold where we are now and not open further for 2 weeks.
Good. Thank you. Good answer. My next question is probably for both of you. That is to say for you, Dr. Doohan, and also for Ms. Angelo. Can either one of you fill us in on what's happening with regard to negotiations with the state for a public health officer after you move on to your next job?
Well, I'll start out, and then I would ask CEO Carmel Angelo to follow. I'm still the health officer, and county must have one health officer. We've been in close communication with the state to clarify what the requirements are for a health officer. So like our great sheriff, you have to have one sheriff, and you must have a sheriff, and you must have a health officer, and it must be one person. So I am the health officer, and I will continue to serve in that role. We do have the job posted, and it is a job for one person to apply to, and we really hope that there will be a physician, that's another requirement, that applies for this job, and that application will come in very soon. We are aware of 2 individuals that have expressed interest that are known in this local area, and we're really hoping that they'll submit applications. But Carmel Angelo, would you like to answer further?
Thank you, Dr. Doohan. I would just echo what you've said. We do have 2 candidates. We are waiting for applications, and we have had good luck with the state. They have been available to help us for the last 4 years with any event that we've had, any emergency event. So the state is right there. They've been talking with Dr. Doohan, and we trust that as Dr. Doohan goes into more of a consultant role later this year, that we will have a health officer to replace her. But again, as Dr. Doohan said, today she is our health officer, and we're very fortunate to have her with us. Thank you.
Can I ask one more little teensy weensy question?
Sure.
Okay. Understanding Dr. Doohan was that June 4th was going to be your last day. Does that still hold, or has that changed?
So the Board of Supervisors voted that my role would continue until December 31st. So there was the goal of me transitioning to be a consultant. So I was, I served the Board of Supervisors, but they did not end my contract June 4th, but the goal was to transition to a new health officer. So as soon as we have a new health officer, that will happen. But I'm still remaining.
Okay, thank you so much.
Thank you. Next up, we have Matt with KMUD.
CEO Angelo, Dr. Doohan, Sheriff Kendall, Ms. Duquette, thank you for allowing this press conference today. So both of my questions are related to these 2 somewhat kind of conflicting realities we're facing with reopening and the rising cases. I think that's what a lot of community members are concerned about. So my first question, as we kind of stare down opening up with the rise of cases, Dr. Doohan, CEO Angelo, Sheriff Kendall, I think probably all of you from your perspectives could address this in some way. How would you assess Mendocino County's ability to address a surge if it came about?
Well, I can start out by saying that we had modeling data early on from scientists that have been providing modeling of the pandemic for example, Sonoma County and other locations around the world, actually. And what this modeling data showed us is that if we even decrease by 25% our contacts, we can do a significant amount to flatten the curve. So what we did initially, based on this modeling data in Mendocino County, was a 75% reduction in social contacts. It was a significant, we really flattened the curve. I mean, that's why we had so many few cases in the beginning, because with our activities and our behaviors, we had a 75% reduction in contacts. I would estimate that what we're doing now is opened us up by 25% more. So we're at about a 50% reduction is where I think we're going to be now. And even based on that modeling with a 50% reduction, we can still handle the surge that we'll have in our county. It'll be slower, it'll roll out more slowly, giving us time for more treatments and a vaccine. So I think if we can stay where we are now, the longer we can stay there, I think we're going to be good, which is why I said I don't think we need to go backwards. Now, if we were to open up even more, what would opening up more look like? Opening up for tourism, opening up camping, lodging, day trippers from the Bay Area. That would be, to me, what opening up even more would involve. I think that would be a real stress on our system right now. But in as much we can hold the line where we are now, and I say that with a heavy heart because I know we love our businesses in our county that provide tourism, the beautiful lodging and all of this, the campgrounds. But I think that that's where I'm very, very worried if we opened up that to that extent at this time. I think if we hold the line now, we will be able, with our resources in the hospital, which surged up, with our clinics, with all of our partners, I think we will be able to get through this without exceeding our capacity in our county.
Thank you for addressing that question, Dr. Doohan. And my second one is sort of about testing and how testing is going to shift in the time of community spread. how will our testing strategies sort of shift? Will we see an increase in availability for essential workers, people not experiencing symptoms? Will we see an increase in staffing of contact tracers? How do we kind of bolster our resources once that community spread sort of comes home?
Yeah, well, that's exactly what we're doing. And in Mendocino County, because of our very strong team and the pandemic response, we've done everything early. So we have been doing all of the things that you just mentioned, Matt, early before we had community spread. And because of that, our teams have gotten good at it. We call them the swab squad. You know, we have our team that goes out. If we have a case, then we wrap around that case our swab squad. And we're doing it right now today. They're out there because we've had some cases where we are looking at doing the case investigation, the contact tracing. We've gotten good at it because we've been doing it now for months. So you will see more case investigation, contact tracing efforts with testing surrounding that. You'll see more people being put in isolation and quarantine housing, which the county has acquired and is free housing that we can provide for people. And you'll see more surveillance. We were already doing the surveillance. And our goal was 135 tests a day. We were doing that before we even got OptumServe. But now that we have OptumServe, we've got that resource just really solidly provided. The surveillance we were doing before, we were worried from week to week whether we'd be able to keep it up because we weren't sure if the lab we were sending it to would still receive our samples or whether we would run out of sample collection kits. Now with OptumServe, the whole pathway is hardwired. So we know we have the swabs and the sample collection kits, and we have the lab we can send to. All of that's hardwired. So what I think you're going to see is surveillance testing is going to become a way of life, and it will become more widely available around the county. I think you'll see that our frontline workers will get tested with some periodicity, like once a month or once every 2 weeks, depending on their job. Skilled nursing facilities will get periodic testing like that every 2 weeks or every month, depending on if they have an outbreak. So you'll start seeing these, surveillance testing being more just a part of life. And hopefully, as the technology develops, we'll have more of what we call point of care testing that's better at detecting the disease when people are not symptomatic. That's the problem with this low sensitivity testing, the false negatives. So hopefully we'll develop technologies like there isn't even being talked about now, like, the flu test you get. It's a swab and you get the result within minutes, Hopefully we'll have more of that rapid testing that then you could do a confirmatory test after. So more testing capacity, all of that's coming. And that's what having more time gives us the time for that technology to be developed.
Thank you, Matt. Next up, we have Adrian Bowman with Mendo Voice.
Hi, thank you, Sarah. Thank you, Dr. Doohan, CEO Angelo, and Sheriff Kendall. My first question is about enforcement, and I apologize because I actually got cut off and I didn't hear my colleague's last question. So if I'm repeating his question, please just tell me that. My question is about enforcement. Supervisor Williams made a statement earlier this week about enforcement, saying that it was going to get stricter, that business licenses might be revoked. So this is kind of a question for all three of you. And I'm not asking about checking people's licenses or anything like that. Sheriff Kendall, your statements about the Fourth Amendment have been received. But in terms of business enforcement and also in terms of mask wearing enforcement for people on the street or in businesses, can you speak to that?
Were you speaking to me or to the health officer then?
To the health officer and the CEO, and then if you'd like to also comment.
I'll start out by saying that it is not my intention with my orders to have someone arrested, cited, or anything for not wearing a facial covering. We have to depend on the people, the citizens, the people of our county, realizing that this is an important protection and wearing it willingly. And that's why the facial covering order has loopholes. It says if for a medical reason you can't wear one or you can't get one, you don't have to wear one. The exception would be that I actually am saying that if you're an employee working in a public-facing job, you should wear one. And my expectation would be, or preparing food, that the employer would just put that worker in a different job location if they weren't able to wear a facial covering. But it's not meant to be something that people would be arrested for example. So I would never hope that that would be the implication. So I just wanted to lead by saying that. So to my colleagues, that was all I had to say.
And then as it pertains to businesses that might be violating things, will the county be revoking business licenses? Will code enforcement be going in? What plans are in the works for that?
So could I ask Carmel Angelo to weigh in on that?
Sorry, I meant that for CEO Angelo.
Okay, well, thank you. Code enforcement is, the code enforcement gets complex because we have three different components. Sheriff Kendall is part of code enforcement, certainly our code enforcement unit under Trent Taylor, and then our special investigations unit in Health and Human Services. So along with the orders, we do have a commitment from all three components of code enforcement that they will work with the health officer and certainly with the direction of the Board of Supervisors to enforce the public health orders. So that is the best answer that I could give you at this point. Perhaps Sheriff Kendall would like to add to that. Thank you.
Thank you for the question, Adrian. So the Sheriff's Office will support the code enforcement when it comes to businesses and whatnot. They have been doing most of the businesses, while Chief Martyr and my deputies have been doing most of the people contact. And some of the businesses require much more investigation than what we could, put deputies on for a real amount of time because of other crimes. However, if there is a determination that is made that someone is so egregious that these steps have to be taken, then that's what will happen. I would appreciate it if everyone in the county can hear what I'm saying and see me. If you see something that you don't like, don't give that business your money.
Thank you, Adrian. Next up, we have Sarah Reith with KZYX. You're on the air.
Yeah. Hello, can you hear me?
Yes.
Sure can.
Okay. Hi, I'm wondering about testing at congregant facilities like jails and skilled nursing facilities. Are those being tested fairly regularly?
Yes, that's a great question. We've been doing this for months now. So we have a weekly call with the skilled nursing facilities and the assisted living facilities, the care homes. We have a weekly call with the jail. And we have what we call facilitated public health testing where, for example, in the jail has medical in the jail through a company called NAFCare and has a great medical team there. So they will collect the samples and then the public health lab will, through a courier, deliver those samples to our public health lab in Sonoma County that we share a contract with, or the lab in Richmond if it's an outbreak. We don't have an outbreak in the jail, but if we did. So we've been doing that for months. For example, there have been cases where an arrestee's been transferred from one place to our jail where we were concerned that maybe in that other state, that other location, they might have been exposed, and we would, the jail would put that arrestee in an isolation cell, and then we would do the testing, and when it came back, we would be able to make sure that person could go back in the general population of the jail. In the skilled nursing facility, that's just one example. We do regular surveillance testing with the skilled nursing facilities and including their workers. And that's something we've done, for months. So it's very important to do this. We've also done this with our other congregate settings, like our people experiencing homelessness. And we also do it for our frontline workers, our county employees. So yes, the answer is yes. And we have been doing this and we will continue to do this moving forward.
Thank you. And my other question also has a law enforcement component to it. I'm wondering what the information sharing arrangement is between law enforcement and public health. If the people who need to know what areas are unsafe have the information they need to conduct investigations safely.
I can answer that one. The sheriff's office has a data bank right now. Public health is sharing very limited information with us, but it is plenty to let us know if there is an officer safety risk at a certain location. We don't receive names, and we don't receive anything that would violate the rights. However, we have enough information that I'm comfortable with my deputies being able to respond to locations without putting themselves in harm's way.
All right. Thank you.
Thank you, Sarah. We missed Menda Voice's second question, so Adrian's back on the line. Go forward with your second question.
Hey, thanks, Sarah. Yeah, we had a little glitch there. This is for Dr. Doohan. Dr. Doohan, you mentioned this already earlier in your interview about whether or not the spike in cases we're seeing are a reflection of spread versus an artifact of the data from testing, additional testing. I was wondering if you could actually drill down on that, because that is something that we're seeing a lot of discussion about in social media.
Yeah.
How can you tell that this is actually more cases versus just observing more cases?
Well, we've done about 3,800 tests that have been resulted in our county, and only of all the surveillance testing that we've done, there's only one new case that came out of it. Well, there's been 2 cases that have come out of surveillance testing. One was actually a household member. We already knew about that person, and they had completed quarantine and they had never been sick. The other was, like I mentioned, someone that was from another county. So as
that was in Anderson Valley?
Yeah.
Okay.
So when we're doing surveillance testing, you would expect, if you do a lot of surveillance testing, there would be more cases coming from that. You know, if you had a lot of community spread, you'd start detecting a lot of cases in that way. The new cases that we've had have come from people being sick and actually going to the hospital or clinic, which is a different, it's true that we're doing more testing, but those people would have gone before. It wasn't because we did more testing that those people got tested. It's because they got sick. And so actually what I would say about that is that worries me. It worries me that these people went when they got, that it wasn't until they got sick that they went to the hospital or clinic. I'm worried that people aren't coming forward enough for surveillance testing. I'm afraid that we need to see more people coming for surveillance testing. And when we start picking up cases from our surveillance testing, then I'm going to say that it's related to doing more testing. Whereas if people are actually ill and go and seek medical care, we would have picked them up regardless if we did more testing or not.
Mm-hmm. So what do you say to people about that? Like, what's that hurdle to say, okay, I'm going to get in the line, I'm going to get in my car, I'm going to stand in line for an hour and have something shoved up my nose? Like, how do you encourage people to actually go for that?
Yeah. Well, there's a couple factors. One, we want them to know it's free. And the other is that I am working to not have to shove something so far up someone's nose. That has to do with the swabs that are available and also the technology that's being developed. There is technology now that we could consider to do a swab that doesn't go so deep, but we need to get those swabs and they're not available. So I think there is some people that are resistant because they're worried about the swab, but it's really not a major thing. So I would encourage people not to be scared of the nasopharyngeal swab. But I also think that there's a real concern for people that if they test positive, they won't be able to go to work, that they'll have to quarantine, or if they're positive, they'll have to isolate, and they don't see how that would work out for them to not be able to go to work. So this is something I'm very concerned about, and we have resources in the county that are there to support people that aren't able to go to work, but that's not actually my area. I would have to defer that issue about what people would do, what kind of supports they would have if they aren't able to work. But I think that's a major barrier. However, what I would say to people is that if you're positive with COVID and you go to work, you could be spreading this to so many people. And so you have to stay home when you're sick. That's something we must have, is people staying home when they're sick and not being afraid of having to stay home if they test positive.
So getting tested, even if you're not symptomatic, that's something you're sort of doing for the community at large.
Yeah, it's surveillance testing.
Thank you. Thank you, Adrian and Mendo Voice. Next up, we have Jackie with El Punta. Jackie, you're on the air, and I believe George is on the Zoom as well.
Thank you, Sarah. Thank you for having Periódico El Punto. My first question is, gracias. La primera pregunta es, cuando un trabajador resulta positivo con COVID-19, ¿qué medidas o procesos tiene que hacer el negocio, la empresa o el empleador para proteger la seguridad y la salud de los demás trabajadores?
George, you're on mute.
Yeah. Can you hear me?
Yes.
Oh, okay, sorry. Okay, when a worker is positive or test positive for COVID-19, what measures or process does the business owner have to do in order to protect the safety and health of the other workers?
So in the blanket isolation and quarantine orders that are online, which are translated in Spanish, you'll find some very good descriptions of what needs to be done at home for people that are isolating at home to keep their home safe. And that's just one thing I would like you to be aware of. In businesses, it's the hygiene protocols that we have that we require businesses to undertake. Those will protect the other workers from COVID-19. The COVID-19 virus, the SARS-CoV-2 virus, can stay on surfaces up to 72 hours. So cleaning surfaces with disinfectants is part of what is very important to do if somebody has had COVID in a workplace. That would be one of the very important elements. And then of course, wearing the facial coverings. The facial covering protects another person from getting the infection from you. And the social distancing, all of these are protective measures to help prevent the spread.
Okay. Hay información que existe en la página web del Condado de Mendocino, en la cual nosotros hablamos sobre los cuidados que tenemos que tener tanto en casa como en una empresa o negocio. En el caso para un negocio, hay protocolos de higiene que explican qué podemos hacer nosotros en el caso de que algún trabajador resulte positivo. Recordemos que este virus, el COVID-19, puede vivir en superficies hasta por 72 horas. Por eso es importante limpiar las áreas, las superficies, limpiarlas con un desinfectante de manera regular y usar el protector facial y igualmente mantener el distanciamiento social en el área de trabajo.
Okay. Bueno, entonces la segunda pregunta es, ¿cómo se está asegurando el Departamento de Salud Pública que la persona infectada con COVID-19 está aislada y que otras personas expuestas estén cumpliendo la cuarentena? ¿Se puede obligar a las personas que han sido expuestas a alguien con el virus a hacerse la prueba de COVID-19?
Okay. How is the Mendocino County Public Health Department making sure that the person infected with COVID-19 is isolated and that the other exposed people are complying with the quarantine? The second part of the same question is, can people who have been exposed to someone with the virus be forced to get tested for COVID-19?
So thank you. The isolation and quarantine orders on the website describe some details that I think are helpful in the answer. We don't force people ever to be tested. So this is something that they choose. Our public health department follows up daily with people in isolation and quarantine, and George is very, very helpful. He can talk about that. So if somebody is Spanish speaking, we have a team, including George, who calls regularly to check on the person if they need housing, because let's say they're a family living in a small house. If we need to get one of the family members away from the others for isolation, we can provide free housing, we can provide food. And our team calls every day during that period of time for the isolation or quarantine. And isolation is 10 days from, the simplest way to think of it is 10 days from the date of the test. And the person needs to also have no fever for 3 days and be improving. That's the period of isolation. Quarantine is 14 days from last contact. And so our team is in daily contact, including providing food and housing if needed.
Ok, nosotros aquí en el condado de Mendocino tenemos un equipo que nosotros le llamamos investigadores de caso, o le llamamos personas que hacen el seguimiento de los casos. ¿Okay? Seguimiento de casos y el investigador de casos. Son dos grupos diferentes o dos personas diferentes. Entonces, el investigador del caso es la persona que va a determinar todos los contactos que la persona que dio positivo al COVID-19, todos los contactos que tuvo en las últimas 2 semanas, las últimas semanas, perdón, todos los contactos que tuvo en ese periodo, porque se supone que en ese periodo él estuvo en capacidad de poder contagiar. Bueno, en realidad o sea, si todo depende de cuándo empezaron los síntomas. O sea, le preguntamos cuándo empiezan los síntomas y de acuerdo a cuándo empezaron los síntomas nosotros retrocedemos 2 días. De acuerdo a eso ya todos los contactos que han sido identificados en ese periodo pasan a la persona que le llaman el seguimiento de los casos. Entonces la persona que el seguimiento de casos llama a las personas que han estado en contacto, se les informa, usted ha estado en contacto con una persona que supuestamente está positivo y usted tiene que quedarse en la casa o tiene que estar bajo cuarentena. La persona que dio positivo al caso, esta persona tiene que estar en aislamiento. O sea, el que dio positivo está en aislamiento y el que estuvo en contacto tiene que estar en cuarentena. Son dos cosas distintas. Y nosotros, este equipo que tenemos, nosotros le llamamos todos los días. A la persona que dio positivo le llamamos 2 veces al día, recordándole, señor, ¿cómo está usted? O señora, ¿cómo está usted? Algún síntoma nuevo, algo en relación al día de ayer, se tomó la temperatura, etcétera, y siempre le recordamos que tiene que estar en casa aislada. Ahora, si esta persona, por ejemplo, no tiene los recursos para poder quedarse en casa porque hay mucha gente viviendo allí o hay una persona en riesgo, entonces le ofrecemos la posibilidad a esta persona de poder estar en un hotel y nosotros le damos la alimentación y todo, eso lo paga el condado. O sea, la persona no tiene que preocuparse por los gastos. O si esta persona tiene que trabajar, por ejemplo, y es la única persona que da el sustento a la familia, entonces también nosotros nos preocupamos porque la familia no sufra de hambre por el periodo que no va a trabajar esta persona. Y igualmente con los casos también nosotros lo llamamos, en este caso solamente una vez al día, y si ha sido un caso que está muy en contacto, que está en el entorno familiar, también lo invitamos a que se haga el test. Nosotros no lo podemos obligar, pero sí nosotros tratamos de explicar la importancia que tome el test. Entonces, cuando ellos entienden la importancia de tomar el test, entonces son pocos los que se han negado. Al inicio de repente pueden estar un poco renuentes, pero al final aceptan, porque es importante saber si ellos están contagiando a otros también. Entonces, hasta ahora hemos podido hacer eso y en la comunidad hispana está respondiendo de manera excelente. Yo creo que hay una gran responsabilidad en esta responsabilidad social que tenemos de no contagiar al vecino, a otras personas, sí que en caso nosotros resultamos ser un contacto o resultamos ser positivos.
Okay. Gracias, George. Thank you, Dr. Doohan.
Thank you, Jackie. Again, thank you, Dr. Doohan, Sheriff Kendall, and CEO Angelo, and our media outlets for joining us today. This has been the Friday COVID-19 update. Thank you, and we'll see you next week.